I'm Midhat Siddiqui and I'm a consultant general surgeon. I specialize mainly in gastrointestinal surgery, but I am an expert in keyhole surgery. So this is doing operations through keyhole or minimally invasive means. Well, a hernia is a weakness or a gap in the muscles of the abdominal wall. Now, the gap allows the contents of the abdominal wall to protrude out, and that's what a hernia is. So most people will see a visible bump or a swelling before they start getting any symptoms. There are two things. A hernia may present completely asymptomatically, so the patient may one day just feel their abdominal wall and notice a swelling or a bulge, which obviously would be quite alarming. But often it follows some sort of either very excessive exercise or heavy lifting, and they may experience some pain or discomfort. And this is usually aggravated by either walking or doing any activities like lifting or running or cycling. There are a number of treatment options available. The traditional method of operating on these hernias would be coming into hospital, having a general anesthetic, and having a large incision placed over the hernia itself, and the hernia is repaired. But nowadays we can offer what we call keyhole surgery or minimally invasive techniques of repairing these hernias, which means that instead of having a large incision, you can have 2 or 3 tiny incisions on the abdominal wall, and the whole hernia is repaired through keyhole means. If you do nothing, if the hernia is completely asymptomatic and it's a small hernia, it would not be unreasonable to adopt a conservative approach. But people who are very physically active, maybe working, going to the gym, etc., they would feel discomfort on a regular basis, and the hernia never heals itself. It certainly with time may get bigger, and there is a risk of some types of hernias of causing what we call a strangulation or obstruction. So the benefits of surgery are that once the hernia is repaired, you should be able to return to your normal activities without any swellings or discomfort. These days, patients would come in as a day case procedure. It will require an anesthetic, and 3 tiny cameras are placed in the abdominal wall, and the whole hernia is repaired through those minimally invasive means. And usually they can go home the same day, and within a couple of days they return to their normal activities. It varies from different types of hernias, but the commonest hernias, which are the groin hernias or inguinal hernias, or around the umbilicus, the belly button hernias, usually the recovery is pretty quick. With keyhole surgery, most patients say that after a couple of days they are pretty comfortable, able to do their normal routine activities, but we usually say that they should refrain from very heavy lifting for about 2 weeks. And this is different from an open approach, which the recovery can take up to 4 to 8 weeks.